Hello, everyone. My name is Jerdine Perile, and I'm here with my colleagues to discuss about stroke and advanced practice nursing. So, I'm here with Darwin Bautista, Mara Chris Bautista, Sarah Gicale, and Serlina Pichay. Now, guys, I want you to have a little look of this small video that I added in the PowerPoint.
Now he's been wanting to put garlic chives in everything.
Well, not everything.
Dad, the side of your face is drooping. Mom?
It's probably nothing.
Dad, are you okay?
You're slurring. Why are you slurring? Raise your arms up in the air for me.
Dad, are you okay?
Gracie, call 911.
I just
Honey? Tim!
need an ambulance to 7th floor.
Tim, look at me, Gracie. Tell them to hurry. Tim, look at me, Tim.
Mom, what are we talking
I don't know. I think he's having a stroke.
I think my dad is having a stroke.
Tim, what's going on, baby? My husband, he. I think he's cold. Are you cold, honey? Are you cold? Okay. Gracie? See, Gracie's gonna come, sweetheart. We're just gonna go in the ambulance right now. We're gonna go to the hospital. Okay? Okay. Huh? I'm right here. Gracie, meet us there. I'm right here. Okay. Okay, here we go. You just stay right here. You just stay and breathe. Just breathe. Tim?
Dad?
How you feeling?
I'm fine.
Well, you've had a stroke. But because you got here quickly, you're looking at a full recovery.
So that's the end of that video.
Now he's...
Now, what are our insights about the video? We could really see that an immediate intervention could actually help prevent brain damage for patients who are having stroke. And obviously, if you're not in a medical field and you don't know that this patient is actually having a stroke, what would be the signs and symptoms that when you see it, you know that it's a stroke? And with giving immediate intervention or even just calling the ambulance and bringing the patient to the hospital, this could actually change the lives of a patient or a person who is having stroke. Now, what is stroke? I'm gonna have to show you another video.
Every 2 seconds, someone somewhere in the world experiences a stroke, and 1 out of every 6 people will have one at some point in their lives. Strokes deprive brain cells of oxygen and are one of the most common causes of death and a leading cause of preventable disability. When someone experiences a stroke, quick medical care is critical and can often help avoid permanent brain damage. But what causes strokes in the first place, and what can doctors do to treat them? The brain makes up just 2% of your body's mass, but consumes more than 20% of the oxygen in your blood. That oxygen is carried to the brain through a system of arteries. Carotid arteries supply the front of the brain, and vertebral arteries supply the back. These are connected to each other and divide into smaller and smaller vessels that get billions of neurons the oxygen they need. If the blood flow is interrupted, oxygen delivery stops and brain cells die. There are 2 ways this can happen. Hemorrhagic strokes are when a perforated vessel allows blood to leak out. But the more common type is the ischemic stroke, when a clot blocks a vessel and brings blood flow to a halt. Where do these clots come from? On rare occasions, a sudden change in heart rhythm prevents the upper chambers of the heart from contracting normally. This slows down blood flow, allowing platelets, clotting factors, and fibrin to stick together. The clot can be carried up towards the arteries and blood vessels supplying the brain, until it gets to one it can't squeeze through. This is called an embolism, and it cuts off the oxygen supply to all the cells downstream. The brain doesn't have pain receptors, so you can't feel the blockage itself. But oxygen deprivation slows brain function and can have sudden, noticeable effects. For example, if the affected area is responsible for speech, an individual's words may be slurred. If the stroke affects a part of the brain that controls muscle movement, it can cause weakness, often just on one side of the body. When this happens, the body will immediately try to compensate by diverting blood flow to the affected area, but this isn't a perfect solution. Eventually, the oxygen-deprived cells will start to die, leading to brain damage that may be severe or permanent. That's why it's important to get medical care as fast as possible. The first line of treatment is an intravenous medication called tissue plasminogen activator, which can break up the blood clot and allow blood to flow again in the compromised artery. If it's delivered within a few hours, this medication greatly increases the chance of surviving the stroke and avoiding permanent consequences. If tissue plasminogen activator cannot be given because the patient is on certain medications, has history of major bleeding, or the clot is particularly large, doctors can perform a procedure called an endovascular thrombectomy. Using a fluorescent dye that illuminates the blood vessels under a strong X-ray, the physician inserts a long, thin, flexible tube called a catheter into an artery in the leg and maneuvers it all the way to the blockage. A retriever is passed through this catheter. It expands and anchors into the clot when it's just past it. The catheter then pulls the clot out when it's removed. These treatments need to be delivered as soon as possible to preserve brain function, which means figuring out fast if someone is having a stroke. So how can you tell? Here are 3 quick things to try. 1. Ask the person to smile. A crooked mouth or facial drooping can indicate muscle weakness. 2. Ask them to raise their arms. If one drifts downward, that arm weakness is also a sign of a stroke. 3. Ask them to repeat a simple word or phrase. If their speech sounds slurred or strange, it could mean that the language area of their brain is oxygen deprived. This is sometimes called the FAST test, and the T stands for time. If you see any of those signs, call emergency services right away. Lives may depend on it. We're on a non-profit mission to revolutionize education. Click here to learn how you can get involved.
Alright, thank you so much for watching that video. I hope it was informative enough to give you details about stroke. Let's go on to the next slide. So what will increase the stroke risk? Now, what are the risk factors? Obesity, high blood pressure, high cholesterol, smoking, diabetes, genetics and family history, age 55 and above. Stroke is more common in female and races of non-Hispanic, Black, or Pacific Islander. What are the diagnostic examinations that we use? There is CT imaging, which means it uses a series of X-rays to create a detailed image of your brain. A CT scan shows bleeding in the brain, ischemic stroke, or a tumor or other conditions. MRI brain or magnetic resonance imaging. This uses powerful radio waves and a magnetic field to create a detailed view of the brain. The test can detect brain tissue damage by an ischemic stroke and brain hemorrhages. Carotid ultrasound. A carotid ultrasound shows buildup of fatty deposits called plaques and blood flow in the carotid arteries. There are also bloods taken to see how fast your blood clots and whether your blood sugar is low. You will also be tested to see if you have any infection. Physical examination. A neurological exam looks at how a potential stroke is affecting your nervous system. We also have cerebral angiogram, wherein it provides a detailed view of arteries in the brain and neck. A thin flexible tube called a catheter is inserted through a small incision, usually in the groin, and a dye is injected into the blood vessel to make arteries visible under X-ray imaging. And lastly is echo. This can find source of clots in the heart that may have traveled to the brain and caused stroke. What are the management of stroke? Let's go on to the pharmacological. So as you saw in the video, TPA was used to do thrombolysis to a patient to dissolve the clots that's in the blood vessel of the patient. How about the surgical method? We have thrombectomy, which was also explained in the video earlier. We have carotid endarterectomy. This is a surgery that removes the plaque blocking a carotid artery and may reduce the risk of ischemic stroke. We also have angioplasty and stents, wherein a surgeon threads a catheter to the carotid arteries through an artery in the groin. A balloon is inflated to expand the narrowed artery. Then, a stent can be inserted to support the open artery. With hemorrhagic stroke, surgical clippings are also done. If the area of bleeding is large, you may need surgery to remove the blood and relieve pressure on your brain. Surgical clipping is when a surgeon places a tiny clamp at the base of an aneurysm to stop the blood flow to it. The clamp can keep the aneurysm from bursting, or the clamp can keep an aneurysm that has recently burst from bleeding again. Coiling or endovascular embolization. A catheter is inserted into an artery in the groin and guided to the brain. Using the catheter, a surgeon places tiny coils into the aneurysm to fill it. This blocks blood flow into the aneurysm and causes blood to clot. Surgical removal of a tangle of tiny walled blood vessels known as AVM. This removes the risk of rupture and lowers the risk of hemorrhagic stroke. However, it is not possible to remove an AVM if it's deep within the brain or if it's large. It may also not be possible to remove if the procedure would impact brain function. Lastly is stereotactic radiosurgery. This uses multiple beams of highly focused radiation to repair blood vessels malformations. Stereotactic radiosurgery is an advanced treatment that's not as invasive as other procedures. How about prevention of stroke? First, it is advised to choose healthy foods and drinks, or healthy diet. Keep a healthy weight, regular physical activity, don't smoke, limit alcohol, control medical conditions such as blood pressure and blood sugar, check cholesterol, treat heart disease, and take your medication. Stroke recovery and rehabilitation. After emergency treatment, you're closely monitored for at least a day. After that, stroke care focuses on helping you recover as much function as possible and to return to independent living. The impact of stroke depends on the area of the brain involved and the amount of tissue damage. Rehabilitation may begin before you leave the hospital. Every person's stroke recovery is different depending on your condition, and your treatment team may include neurologist, physiatrist, rehabilitation nurse, dietitian, physical therapist, occupational therapist, recreational therapist, speech pathologist, social worker or case manager, psychologist or psychiatrist, and chaplain. All of these people work together to help you achieve the goal of recovery from stroke. Let's dive in to advanced practice nursing. Advanced practice nursing roles and responsibilities. Let's have an overview of advanced practice nursing. The nursing field of expertise functioning on a wider level of healthcare services that go beyond traditional nursing. Advanced practice nursing or nurses are generalists or specialists who achieve an advanced level of education and training. This requires advanced degrees such as master's or doctoral in nursing. What are the characteristics of advanced practice nurses? Advanced practice nurses should possess an expert in in-depth knowledge and understanding of the nursing theory, advanced clinical practices, and healthcare systems. They should be well knowledgeable of the complex topics such as pathophysiology, pharmacology, advanced assessments, and healthcare ethics. While some may remain generalists, many choose specialized areas such as family practice, pediatrics, geriatrics, psychiatry, or acute care. APN's role also involves execution of clinical judgment and critical thinking. They are trained to make complex clinical decisions in high stakes situations. They assess, diagnose conditions, interpret diagnostic tests, and develop comprehensive care plans. Critical thinking is used to solve complex patient care issues, and with the aid of evidence based practices, it guides the decision making. What are the types of advanced practice nurses? First are nurse practitioners. Nurse practitioners' main goal is to bridge the role of both a nurse and a doctor. Their expertise is to conduct comprehensive physical exams, diagnostic and interpret diagnostic tests like lab works and x-rays and ECGs. They develop and implement plans and prescribe medications and provide ongoing management of chronic diseases. Autonomy in the role is also one of the characteristics of advanced nursing practitioners. They either work independently or in collaboration with the team. Clinical nurse specialists. Their role is multifaceted, encompassing direct patient care, consultation, education, research, and leadership within the area of expertise. They focus on improving patient outcomes and nursing practices through evidence-based interventions, and they play a key role in healthcare settings by influencing clinical practice and policy. They assess, diagnose, and manage patient care, often focusing on areas such as pain management, wound care, or oncology, critical care or oncology. Certified nurse midwives. Their focus is to provide care to women, particularly related to pregnancy, childbirth, postpartum, and reproductive health. And lastly, certified registered nurse anesthetists. Their specialization is to administer anesthesia and provide post-anesthesia care before, during, and after surgical, therapeutic, diagnostic, and obstetric procedures. They play a critical role in ensuring that patients are safe while undergoing medical procedures under the anesthesia. Now, let's go deeper into advanced nurse practice in acute care. Stroke is a life-threatening medical emergency that needs a prompt identification and treatment. Rapid response to stroke symptoms is very crucial for better chances of preserving brain functions and improving long-term goals. Stroke ANPs are now the first-hand contact of patient after coming to A&E. They are involved in rapid assessments and diagnosis of stroke patients. With the use of their clinical expertise, they can quickly identify the type of stroke and assess the severity of the conditions using tools such as NIHSS. ANPs has the autonomy to coordinate immediate investigations such as CT scan imagings, carotid Dopplers, and chest x-rays. They are also trained to provide treatment independently, such as administering thrombolytic therapy for eligible ischemic patients, and they work closely with neurologists and other healthcare providers to ensure timely and appropriate treatment, which is critical in minimizing brain damage and improving outcomes. Stroke ANPs also develop and implement individualized and patient-specific care plans. These plans include acute treatment, secondary prevention, rehabilitation, and long-term care strategies. They also send referrals to members of multidisciplinary team. In addition, stroke ANPs provide education to patients and their families about the recovery, stroke prevention, lifestyle modification, and the importance of adherence to rehabilitation and medication regimens. They also play an important role in secondary prevention by managing risk factors that could lead to another stroke, such as hypertension, diabetes, atrial fibrillation, hyperlipidemia, and lifestyle factors like smoking and diet. In many healthcare settings, stroke ANPs may act as leaders in stroke units, making sure that protocols are implemented, leading to improved quality of care and ensuring adherence to national stroke guidelines. Now, Let's continue to the panel discussion. For the first question, why is there a need for advanced practice nurses in acute stroke care?
Well, in, in stroke care, APNs are essential because they provide specialized knowledge that can dramatically impact patient outcomes. Their ability to perform rapid assessments using tools like the NIH Stroke Care Scale and initiate treatments such as thrombolytics is crucial in minimizing brain damage and improving recovery chances. Their presence ensures that critical decisions are made quickly and accurately, which is vital in the time-sensitive context of stroke care.
In my case, for acute stroke care, APNs are invaluable due to their advanced training and expertise in managing complex cases, their role in performing thorough and rapid assessments, coordinating immediate care, and developing patient-specific plans is crucial. By leveraging their skills, APNs can ensure that stroke patients receive prompt and appropriate care, which directly impacts their recovery and long-term outcomes.
Yeah, for us, APNs are essential in acute stroke care for their advanced clinical skills and decision-making abilities. They play a key role in coordinating care, administering treatments, and monitoring patients' progress. Their expertise allows for more streamlined and effective response for stroke, ensuring that patients receive the best possible care in a critical time frame.
In acute stroke settings, APNs are needed for their specialized knowledge and ability to manage complex situations. They are adept at performing rapid assessment and implementing immediate treatment protocols, which are crucial for improving patients' outcomes and reducing the risk of long-term disabilities.
Advanced practice nurses are critical in acute stroke care due to their role in delivering high quality, evidence based interventions. Their training allows them to perform detailed assessments, initiate timely treatments, and collaborate effectively with other healthcare professionals. This comprehensive approach is essential for optimizing patient care and recovery.
Thank you for that. Let's go on to the next question. How can your findings be applied in your current workplace or country?
Well, in California, where there is high prevalence of stroke and significant healthcare needs, integrating APNs into stroke care teams can enhance response times and treatment efficiency or efficacy. Establishing specialized stroke units and incorporating advanced practice roles into emergency response protocols, we can improve patient outcomes and ensure that stroke care is both timely and effective.
In Ireland, where specialized stroke care resources may be limited, implementing advanced practice roles can greatly enhance stroke management. By training and integrating APNs into our stroke care teams, we can improve the quality of care, streamline processes, and address the unique needs of our patients' population, ultimately leading to better outcomes.
While here in Arizona, the inclusions of advanced practical nurse in stroke can lead to significant improvements in patients' management by developing and implementing advanced practice protocols and providing specialized training for nursing staff. We can enhance the quality of care provided to stroke patients. This approach will help in better managing complex cases and improving overall patients' outcomes in our healthcare facility.
In Arizona, the integration of APNs into stroke care can address gaps in specialized care. By establishing protocols for rapid assessment and treatment and ensuring the APNs are part of the stroke care teams, we can enhance the effectiveness of stroke management. This will lead to more efficient care delivery and better outcomes for patients experiencing acute stroke.
Here in Oregon, integrating APNs into stroke care can help address the challenges of workforce shortages and improve patient care across both urban and rural settings. By incorporating APNs into stroke care teams and using their specialized skills, we can ensure that all patients have access to high quality and timely care. This approach will enhance patient outcomes and support the overall effectiveness of our stroke care services.
Thank you so much for that. We are going on to the conclusion. So, advanced practice nurses play a crucial role in various specialties, enhancing patient care through their advanced training and expertise. Their impact is profound, and their integration into healthcare systems can lead to improved quality outcomes and more efficient care delivery. Their expertise enhances care quality and addresses healthcare needs effectively. So thank you so much for watching this video. I hope you learned something from the video, and you can always comment down on the comment section if you feel that you have been educated by this video. Thank you